Hello everyone, this is Chadi Alraies from CVI 22 in Denver, Colorado. With me is Dr. Adnan Halboni. He is a third-year chief resident at Wayne State University, and he's applying for cardiology, and he's presenting at CVI. Adnan, thanks for being with us.
Thank you so much, Dr. Alraies. It's really a pleasure to be here.
Thank you.
It's a pleasure to be here at the CVI.
Yes, your first time as well?
Oh, it's my first time. It's my first time in Denver, and it's my first time here in CVI, and it's pretty amazing so far. I've been having lots of fun, meeting lots of people, learning so much, so much.
Yeah. So you're presenting also an abstract about
yes.
MitraClip and A Fib burden.
Yes.
So can you tell us about it?
Oh, of course. So basically, we did a meta-analysis, and we looked at all the literature, and we basically compared the outcomes of MitraClip in patients who had atrial fibrillation versus patients who did not have atrial fibrillation. We included 10 available studies in our literature search and in our meta-analysis. There was one randomized controlled trial. There was one post-hoc of a randomized controlled trial. The others were observational. There was one large database. And basically what we found is that on follow-up, patients with atrial fibrillation who had MitraClip had a higher risk of all-cause mortality and heart failure hospitalization. However, there was no difference between patients with AFib and no AFib who underwent MitraClip in either in-hospital mortality, cardiovascular mortality, stroke, procedural time, and even New York Heart Association 1 or 2 at follow-up.
Okay.
Yeah, they had a similar number were in New York Heart Association 1 or 2 at follow-up.
Any bleeding difference?
No bleeding difference. No bleeding difference also.
Any of these patients, I'm assuming the AFib cohort was on anticoagulation, so I was assuming there might be some risk of bleeding.
Yes, you'd assume so, but we didn't. And even although numbers of clips were not different between both, and also procedural time, as I mentioned, was not different between both. No bleeding and no stroke risk.
So basically, somebody with AFib and mitral valve disease, the risk of having any complications is all the same.
Except all-cause mortality and heart failure hospitalization. The rest, there's no difference.
So how do you think we should, based on these findings, how you're going to tune up and change your practice for these patients post-AFib?
So basically, I mean, I think that, we should take this into consideration with discussion with the patients. That should not prevent, I believe, if a patient is indicated to have a MitraClip, this study should not prevent, but it can alter the course of the conversation with the patient and the expectation that you would have after this.
Especially the heart failure.
Heart failure, exactly. Of course, guideline therapy for heart failure and all of that stuff should be pursued.
Absolutely. Well, congratulations for the study.
Thank you so much.
Yeah, and I know the paper under review now.
Yes, we have submitted a manuscript and it's under review, and hopefully we can, within the next few weeks, we'll hear some good news.
Yeah, thank you so much. Please watch this video and others on CVI YouTube channel. This is Chadi Alraies from Denver, Colorado. Adnan, thanks again.
Thank you so much, Dr. Alraies.